Aging is inevitable. The aging process affects our overall health in different ways. As we reach our senior years, we and our caregivers will be confronted with challenges and difficult decisions that need to be made regarding our quality of life. On this edition of the Mayor's Show, we will examine 4 important issues facing seniors. Local experts will share their insights on topics critical to seniors so that we will be better informed to make the right choices. In addition, we will also see how some seniors in our own community are showing us that age truly is just a number and you're only as old as you feel.
Greenwood Village is an attractive community for people to retire and enjoy their senior years in a graceful setting. Did you know that 1 out of every 8 residents in the region is over the age of 60? And by 2035, more than 1 in 4 people will be 60 years of age or older? In the next 5 years, it is estimated our region will experience a 30% increase in persons over the age of 60 due to the baby boomers. With an increased aging population, exercise and wellness play vital roles in the survival age of seniors today. Village residents David and Karen Gim know what it means to practice good senior health. It all started when Karen was injured at work as a commercial flight instructor.
I was injured at work doing bags, and so I was not able to walk or do anything for a while. And we had to get a lawyer to get the surgery, and after that, they actually had my rehab at Greenwood Athletic Club, which started that. And after that, it was therapies and exercising, and water was one of the best exercises. And I had the back surgery, and then I got rheumatoid arthritis, and that caused some other health issues. And I've had 2 back surgeries and knee replacements, both knees replaced.
Karen's health issues prompted her husband Dave to retire as an aerospace engineer to stay home and take care of his wife. After all, they only had each other, so they were in it together.
I'd see her laying in bed, shaking, shriveled up. I feel a loser. I had to quit work. I had to be home. I had to be with her. We had to share our lives. We had to do things again. We can't have it land now. And that's how we set up our routine of the gym, mental activities, doing things we enjoy. But otherwise, she wouldn't have been here. And that would have been probably really, really bad. That's hard to talk about. She was going to die.
It has been 13 years since the onset of Karen's health issues, and today she is stronger and feeling better than ever at 71. Dave, who is 76 years of age, says his health is great too. They both credit their health to their daily visits at the Greenwood Athletic Club.
Myself, I go down and I go through the weight room. I have a circuit, they call it, working all the different body parts, exercising. Key is you don't do anything that hurts. Objective is I can come back tomorrow and still feel good and do it. This also helps you sleep very well. And then I think I cracked a couple of ribs skiing, which got me into water aerobics with Karen. And I've been doing water aerobics. I do weights 5 days a week and water aerobics 3 days a week, and don't let anybody fool you. That water aerobics can be tough. You like aerobics, don't you?
Mm-hmm. And I usually start out on the treadmill, and then I have the trainer, and then I do water aerobics.
While exercise at the club is a priority for the Gims, they also find time to do other activities at home that keeps them active and stimulates their souls. Karen enjoys keeping a daily journal on her computer and catching up on emails, while Dave takes pride in maintaining his yard to his own perfection and keeping his private collection of books and videos in order. Whatever the task may be, it is not too difficult for either one of them, as they both have their minds set on key factors they say is necessary for good quality of life.
I think the thing is to enjoy your life and be happy. Happiness makes a big difference. If you get into the doldrums and stuff, everything runs down, your health drops. I don't know, your hair falls out, I'm not sure. But don't let that happen. That's just very tough. So enjoy yourself, find a good companion, do things you like. That's probably the best choice.
As you grow older, an active lifestyle is more important than ever. It is proven that exercise can have profound effects on a senior citizen's vitality and overall well-being. For many seniors like the Gims, regular exercise can help boost energy, maintain your independence, and manage symptoms of illness or pain. The Gims will celebrate their 50th wedding anniversary next year. It is because of their commitment to make their health a priority is why they say they are both alive today.
Supposedly exercising and exertion, I think it's endorphins your body generates. That makes you feel well and happy, and we're pretty happy. And that both being that way, because it was very sad when she was having her problems, but now that she's feeling so much better, we can do things together, we can talk about things. Having her mind alert's good. Having her just in pain all the time, it was just tough to talk. So good health is a primary ingredient to achieving a better life.
And to do them together.
Yeah.
That makes you go together. It makes you go.
Yeah, when she can't show up, sometimes I don't want to go to the gym then, but it works out great now.
Your senior years can be some of the best years of your life. Having the best health care and obtaining adequate health insurance coverage is vital to your quality of life and your checking account. Let's find out what types of options are available to seniors today for health insurance. We'll also learn how some self-management wellness programs are effective in helping seniors maintain their health and live longer through the work of a local consortium. I have with me today two guests. The first one is Elias Acosta, owner of Colorado's Insurance Consultant. Elias is the owner of Colorado's Insurance Consultant LLC since 2000 and has over 32 years of experience in the health insurance industry. His expertise involves several senior health insurance such as Medicare, Medicare Supplement, Medicare Advantage, and Part D product offerings. He also navigates through the Health Care Reform and Patient Affordability Act for individual and small group lines of business. Elias's previous experience included serving as an account executive for Anthem Blue Cross and Blue Shield of Colorado until the year 2000. Chris Katzenmeyer, Executive Director, Consortium for Older Adult Wellness, is the Executive Director, and the consortium connects health systems to community-based organizations through training and consulting in the areas of chronic disease and fall prevention in alignment with the Affordable Care Act. Chris is also an adjunct professor at Metropolitan State College in the Health Professions, Nursing and Gerontology Department, as well as director of the Academy for Older Adult Wellness. In 2010, Chris was the Denver Business Journal's Choice for Healthcare Innovator of the Year award. Wow, that's really great. We've got two really great experts with us this morning. So let me start out with the Affordability Care Act of 2012 as to what it is and how it will affect senior health care and insurance. Elias?
Well, I was going to let Chris take the lead on that particular question, so if that's okay, Chris.
That's fine.
Thank
you. The Affordable Care Act, which we call the ACA, is also called Obamacare, which probably most people have heard about now. When it was called the Affordable Care Act and enacted in March 2010, most people didn't quite know what to call it, what it was, what it did. And I have to say that it's just now kind of coming around to the general public as to what it does and what it can do. But primarily, it's a statute that was passed in March of 2010, and it was designed and is designed to cover people with insurance and to decrease healthcare costs. And it's being rolled out or has been rolled out since 2010, and will be completely rolled out by 2020.
Elias?
Some of the other speaking points are that the uninsurable now will have a venue where they can purchase health insurance, where previously we only had high-risk plans in certain states. And in terms of ratings, we'll see ratings possibly go down slightly. Gender rating will go away. Again, guaranteed insurability for pre-existing conditions will not be a problem.
What's a rating?
In terms of premium.
Okay, so and that decides if you're in a certain group, how much premium you pay.
Exactly. In the past, if you were female, depending if you were in your childbearing years, you normally paid a higher premium for your health insurance. That role is going to go away because no matter whether you're male or female, you'll get even-tone premiums in the community.
Chris, what is the top health care issues for seniors, or issues?
It's a great question, because I think when we talk healthcare, we're talking health and healthcare. Healthcare is generally what you do with your doctor, or what you do in a hospital, or what you do with an insurance company, and then there's health, which is primarily things like your physical health, your mental health, your emotional health, social health. Healthcare, the top healthcare issues, the ones that doctors and hospitals are dealing with mostly right now, are for people over 65 are decreased physical activity and the repercussions of that, injuries, primarily falls, and the fallout or the problems that come with a variety of chronic diseases and conditions like arthritis, cardiovascular problems, COPD, osteoporosis.
Right. And do you see any other issues or corollaries to that, Elias?
Well, what I see is improvements. I mean, we're living longer. Actuarially, you and I will live much longer years, and with more physical activity, more prevention that the Centers of Medicare and Medicaid are going to offer in their programs in general for those eligible for Medicare, as well as the general insurers that are offering supplements in Medicare Advantage plans. We'll see more preventative care out there as well, because we are living longer.
Great. Chris, how is the Consortium for Older Adult Wellness facilitating a continuum of care for seniors?
The great question. One of the things that hasn't been happening until the Affordable Care Act is a real comfortability from physicians or providers in healthcare referring patients into community resources. So like a physician referring someone to a senior center or to a class in the community that might help them, with their chronic condition or just with their health in general. So one of the things that the consortium has been doing for about the last 5 years, and now with the ACA enacting, we're really going to town, is to really try to help physicians and clinics learn about what's in the community that they can refer their patients to. There are two different languages. There's physician language and then there's community resource language. And for years and years, those two did not talk the same language. So right now we're trying to bridge that language and help providers with referral systems to classes and resources in the community.
So you're a translator.
I'm a translator.
And does this fit into the Healthier Living in Colorado program?
Yes. The Healthier Living Colorado program has another name called the Chronic Disease Self-Management Program, and it's out of Stanford University. It's very quickly becoming embedded and institutionalized in health plans and in clinics and in hospitals. And what it does is it's an actual class. It's a 6-week class where physicians would refer their patients. The patients would go to the class and learn about things like how to manage their fatigue levels, how to manage their physical activity levels, how to eat better, and a variety of other things. And if you have a chronic condition, these are really, really important things. And if you learn how to self-manage yourself, your condition, your disease, yourself in general, you are totally changing the trajectory of your health and also the cost of healthcare. So we have been doing this for about 10 years, and we are seeing amazing, not not only financial results, but definite physical and health results for the people participating.
And this is coming through the management that the consortium offers.
Yes.
Is self-management impacting in terms of how much money seniors spend on their health care, Elias?
Is self-management? Sure. If I can participate in a wellness program, I can mention a couple of programs like Silver Sneakers and Silver and Fit. I'll have access to quality gyms, and again, I can control my blood pressure. I can eliminate some of my cardiovascular diseases. It'll work with depression, and as we get older, these are symptoms that we can manage with diet, as you mentioned earlier, and with exercise.
And Chris, through self-management prevention, have we, in the 10 years you referred to, have we actually seen some metrics that seniors are living longer and more productive lives?
Absolutely. As Elias said, you know, the rate on older adults or older adult age for women has gone up 3 years in just the last 10 years. And a lot of this is because of the prevention kinds of things. And we're also seeing Medicare for the first time offering a wellness visit for people on Medicare, which is designed to help kind of navigate or help a patient navigate what is available in the community as far as wellness. So yes is the answer for sure.
Now let's move more into the health insurance area. Elias, what are the components of Medicare and how does it work? And by that we mean the original extended coverage in parts A, B, C, and D.
Well, let's talk about eligibility. I'm eligible for Medicare when I turn 65. As long as I've worked 40 quarters or 10 years under Social Security, I'm eligible for this health insurance administered by the Centers of Medicare and Medicaid, which is the federal government. I'm also eligible for Medicare if I'm under 65 and have suffered diseases like end-stage renal disease or Lou Gehrig's disease. So I can qualify based on age or I can qualify based on disease. I'm entitled to enroll into 2 parts of Medicare, which we're going to discuss this morning, and we could normally apply for that insurance, parts A and B of Medicare, which is hospital insurance and medical insurance. I can apply for this 3 months prior to my entitlement date or birthday month. I have the month of my birthday month or entitlement date and up to 3 months after. So I actually have a 7-month window where I can enroll in this program called Original Medicare, Parts A, hospital insurance, and Part B, medical insurance. I'd like to maybe take it a little bit further deeper and talk about how Medicare actually works.
Please do.
Thank you, Mayor. In terms of original Medicare, we have Part A hospital insurance, which is an entitlement. We don't pay a premium, but we do have cost sharing in terms of when I'm hospitalized for room and board and operating room and recovery room. I also have a benefit under this Part A hospital insurance for skilled nursing home facility for skilled rehabilitation purposes, and I also have a benefit for home health care. So again, I don't pay a premium monthly for this Part A hospital insurance, but I do have cost sharing in terms of deductibles and daily copays in those 3 environments. The second part to Medicare is Part B, medical insurance, and that's the portion that covers your doctors and anything outpatient hospital. So in terms of my office visits, my clinic visits, my surgeon, my anesthesiologist, my assistant surgeon, my physical therapy, my occupational therapy, durable medical equipment is covered under this Part B medical insurance. Also, if I had an outpatient procedure like a cataract removal at 10 o'clock in the morning and left at 1, outpatient chemotherapy is covered under this Part B medical insurance. That does have a premium, and the standard premium in the calendar year of 2013 currently is $104.90 per month, and we can go into more detail if you wish regarding means testing because there may be some higher income beneficiaries who will pay a little bit more monthly.
Why don't you briefly touch on that?
Sure. Back in 2005, the federal government went into a means testing mode, and they asked for those Medicare beneficiaries with high income, if they were above 85,000 single or 170,000 married couple filing jointly, to pay just a little bit more than the standard rate of $104.90 in the calendar year of 2013.
Parts C and D?
Oh, let me just finish up a little bit more on Part B. In terms of what I have with Part B, I personally would have access to doctors in my local county of Arapahoe County. I would have access to doctors in the state of Colorado, and I can go anywhere nationally. And keep in mind that Medicare is a very traditional payer. Believe it or not, Medicare has a calendar deductible of $147 this year, and then it pays at 80% of allowable charges. Not what the doctor may be billing retail, but it's 80% of what Medicare deems reasonable after the calendar year deductible. Elias, what would be the disadvantage of just staying with original Medicare Parts A and B? Well, the disadvantage is if you had a high utilization year, you're constantly paying those deductibles and daily copays, you're paying the 20% of Medicare's allowable charges on your doctor bills, you're paying excess charges, and Medicare by itself doesn't have a cap or a stop loss. That's where we branch off into the two other options we have available, as you just mentioned. We can go out to the private market and we can purchase what we call a Medicare supplement or a Medigap policy to fill those gaps financially where Medicare leaves off. And depending on what plan I choose, at the end of the day, I possibly could purchase a supplement that can fill those gaps and I can have 100% coverage between original Medicare and my supplement. Then I would add on to that silo or that component, I would add on the Part D prescription drug component, which we're going to talk about in a little bit more detail. Also, as you just mentioned a moment ago, the second option is what we call Medicare Advantage plans or Part C. These are private companies that combine services for doctor and hospital A and B. They can include Part D prescription drug coverage, and they can provide a wealth of preventative and wellness services for you, like routine hearing and vision and dental services for you. They may even offer a gym membership for you. So that's known as what we call a Medicare Part C Medicare Advantage plan.
Different life situations offer and affect your health care coverage options. Working and not working, retired, no coverage. What are those choices, particularly where we have our seniors working a little longer than quote, quote, traditional retirement ages?
Right, and I see that a lot in the community now. I have a lot of employer groups, they're human resources departments that are very confused with the laws regarding Medicare and the working aged. Again, if I'm an individual working in an employer group of 20 or more employees, and I decide to stay on that employer group, or a dependent of a spouse of an employer group that has more than 20 employees, I can elect to stay on that employer-sponsored group health plan if the benefits are fairly rich and the premiums are reasonable. If not, Medicare could be my secondary payer in that situation. If I'm thinking about retiring and maybe I'm beyond the age of 65 and did not enroll in original Medicare when I was first eligible, those individuals will have special election periods where they can enroll in Medicare with no late enrollment penalties, and at that point it opens up a open enrollment for them to purchase their supplements or Part D prescription drug plans, again, with no late enrollment penalties.
Could you spend a little bit more detail on the National Drug Plan and that famous donut hole?
Sure. You know, believe it or not, we didn't have prescription drug coverage for individuals on Medicare prior to the year 2006. The Centers of Medicare and Medicaid and the Department of Health and Human Services did some surveys, and they found that 40% of Americans on Medicare were consuming anywhere from 10 to 14 different medications daily, believe it or not. The federal government knows we're living longer, and actually, you and I may need a prescription or two in our lifetime. And what was really frightening to the Centers of Medicare and Medicaid is, out of that survey, they found people that had income of less than $15,000 annually. And they tried to understand how are they able to live with the cost of living escalating and the cost of prescriptions continuing to go up. So they decided to introduce, back in 2006, January, a nationalized Part D prescription drug plan.
If seniors have more questions about health care coverage, insurance coverage, can you tell us what resources that might be available for them?
Oh, of course. They can always go to Medicare.gov, or they can pick up a publication that's put out by the Social Security Administration on behalf of Medicare, which is called the Medicare and You book. And it'll explain the components of Medicare, it'll explain the supplement and Medicare Advantage plan and how Part D prescription drug plans work. They can also contact the Social Security Administration regarding eligibility and enrollment into Medicare. Other resources would be state assistance or state medical assistance through the SHIP program. Also, we can contact our local county offices if we're limited income and resource, which would be Medicaid. And of course, DORA, the Department of Regulatory Agencies, are a good resource. And of course, your private insurers that are out there in the community that support you and sell and offer Medicare supplement insurances and Advantage plans as well.
In terms of Social Security, in terms of enrollment, there is an office in Littleton. Would you advise an appointment ahead of time as opposed to just dropping by?
Yes, there's an office on South Park in Littleton.
Correct.
They can also call 1-800-772-1213. There's always a representative available from Monday through Friday from 7 to 7.
Great. Is there anything in terms of a focused takeaway that you would want seniors and their caregivers to think about from what you said, Chris?
Certainly. I think the self-management is really about if you know that something is good for you, say if you know that exercise is good for you, if you have diabetes and you know exercise is good for you, just go for a walk. Do what you know is good for you. Self-management is really the courage and the fortitude to do what's good for you. And if you do, you're going to totally change, or you're going to change the direction of your health, and you're going to just feel better. That would be my takeaway for this.
And Elias, your takeaway?
Well, I understand Medicare can be a little bit confusing with all the different moving parts, but there are resources in the community that can assist to make Medicare clear. And I think as we continue to progress, we'll have better quality care, more coordinated care, and lower costs in the future. That's my prediction.
I'd like to thank our guests for coming today. I think you'll agree with me. We were fortunate in having two truly expert people here on set with me today. Your health is your greatest wealth. Take it from this next group of seniors who know the best prescription for a healthier, better retirement is getting out and staying active.